This is my client who has a number of health conditions, including hypermobility syndrome. And have you been validated as having EDS, Ehlers-Danlos syndrome?
Yep.
That's a yes. That's a yes. So tell me about what made you decide to come for treatment at Hesch Institute. And we saw you twice, 2 days in a row. Tell me about your experience, please.
Yeah, so I came here because I've been having SI joint problems and pelvic instability for 2 years now. And I have been trying by different physicians and different physical therapists and chiropractors, trying to find relief for over 2 years. And I could feel the instability, and I could feel when I step or move a certain way, I could feel it crunch or grind or move or become unstable with the simplest movements. And so for the past 2 years, I've been trying to self-treat because I haven't had any relief from the physical therapist that I've gone to or any of the doctors. And so I've gone through so many different physical therapy videos on YouTube and stuff like that to try to get some relief at night when I can't sleep and stuff. And I came across some of your videos, and I actually ended up trying a few different ones until I tried the posterior ilium video. And I had immediate relief, a huge difference, and I can feel the difference in the structure and my alignment and stuff like that. And it was so bad for me before that if I carried my purse on one side or the other, my pelvis was so unstable I couldn't barely walk and stuff like that. And I was using a cane and a mobile for the better part of 8 months, and then I was on and off using a cane until I did the posterior ilium exercises. The reason why I came was because I felt like I either didn't quite get it right or there were still some pieces missing, and I wanted to kind of get the rest of it together. But just after doing the videos, I was like 60 or 70% better. And then after visiting you, I feel so much better. And I also feel taller and more stable, and I feel like more balanced in between my steps, because before when I was walking, it felt like a clunky movement, like it was uneven, and even without the cane I was still limping and stuff like that. So I also noticed that my jaw and neck and upper body and my shoulder problems kind of tie into everything, and you've also helped me identify like what part is like hip pain and what part of it is pelvic pain and what part is SI joint pain. So, and addressing each individually kind of helps me understand what's going on with my body too. So,
Was the manner of evaluation different from what you had experienced? And if so, why is it different? Why is it relevant?
I don't want to speak badly on my other physicians, but I have never had a spring test done before. I've never had manipulation to test what part was twisted or out of alignment. But
Manipulation is not a good word.
okay, because that's a chiropractor term. I meant movement and touch.
Movement testing.
So normally the only thing that they've done is press on my foot, and I had leg weakness. And when you were pressing on my actual sacrum and pelvis, I could feel the difference between when it was locked or stuck and when it was moving again, because it feels like you could feel the lack of movement, and then I could feel the flexibility afterwards. But the thing that I appreciated the most is all of the other physicians and physical therapists ignored my MRI results, and you could see like irregularities or inconsistencies with like misalignment. You can see it in the scan, and I said, does this have anything to do with my pain? And they said, we don't think so. And I didn't understand how that could be. So just addressing what seemed like something that needed to be addressed was significant to me, just because you're looking at the things that are actually out of alignment that you could see in the imaging, and putting it back in. But I've been misdiagnosed with upslips so many times, and especially with hypermobility, they say, well, don't pull on your leg. Like the one treatment they have online for an upslip is to pull on it, and that for 2 years never provided relief anyway, even though I wasn't supposed to be doing it.
So was the technique of testing joint motion is different than what you had experienced.
Very much so.
And we did another film on that.
Right.
So it's on my channel. You can just go to my channel, which is Jerry Hesch, H-E-S like Sam, C-H, then type hypermobility, and you'll find the other video there. So people with EDS, hypermobility, the joints can become stuck, right?
Yes. And it's funny to me because there seems to be excessive mobility on one side and then it sticks on the other side. So
That's a perfect description of what happens. And then when you restore the motion on the side that's stuck, what happens to the other side?
it finally can relax, it loosens and starts to engage and stuff like that. When before, like, I noticed muscles that hadn't moved in a long time moving yesterday, and I was like, oh, I feel more balanced now. Like, there's more activity on both sides instead of one or the other.
And if the joint on one side is stuck and on the other side it moves too much, what happens when you restore the movement? What happens to the side that moves too much?
Relief. I mean, it feels a heck of a lot better.
Does it feel like it moves normally now? It's less hypermobile?
Yeah, I call it clunky. It's less
Yeah,
clunky.
that's a very important concept, okay? There is a false belief, and some people get very upset when you challenge this belief. It's marketed to this population, and it makes the claim that when you have an injury, because you have hypermobility to begin with, that then you develop instability, worse hypermobility, and then it leads to very expensive treatment that's oftentimes not effective. Well, a joint can become stuck, and that's not hypermobility. That's stuck. Okay? In the opposite direction, it can move excessively for a couple of reasons, but when you restore the normal motion, both sides of the joint balance. And so treatment for this population can be simple, direct, cost-effective, quick, if the clinician does a proper job of evaluating the passive motion in the joint. And let's talk about the method of treatment. Can you tell me, for example, when I readjusted your jaw, how long did I take to do that?
3 minutes.
3 minutes.
Yep, that was it.
How much force?
Not much at all, but I could feel it.
Yeah, very, very gentle force.
Yes, very gentle.
And that's important for this population, small forces. So anything else you want to add?
Yes. So the thing that struck me is after 2 years of all the tools and gadgets and belts and bands and all of the exercises and like people saying, well, you have to come 3 times a week for a few months, your solution seemed so simple and easy, it seemed too good to be true, but I could feel the difference in my body. Like, I feel so much better, it feels so much more balanced, and I have so much less pain that I don't want the simpleness to discourage anyone. So if they have to try the videos on YouTube with doctor's supervision or what have you to check it out first, I highly recommend it. So.
And then lastly, this is a whole body approach. I tested every joint in your body.
Top to bottom.
Not just where you told me it hurt.
Right, top to bottom.
Yeah. And you didn't tell me your first rib was stuck. You felt like you knew that it was stuck, but I went and I found it, and then you affirmed, yes, it's felt that way for some time.
And you also found my shoulder problem and my hip problem and everything else. So you already knew about all that stuff. I didn't have to tell you anyway.
Well, thank you very much. I appreciate this.
Thank you.